Hi, I'm Dr. Ken Sharlin. I'd like to talk with you today a little bit about what biomarkers are and how they can help multiple sclerosis. Now, what are biomarkers? Well, or biological markers are measurable indicators of some biological state or condition. They could be used to assess the normal or abnormal functioning of a biological system, like a cell, a tissue, an organ. What is the role of biomarkers in multiple sclerosis? Well, bear in mind that multiple is a chronic and progressive neurological disorder that affects the central nervous system. This consists of the brain and the spinal. MS causes inflammation and damage to the protective layer of myelin that surrounds the nerve fibers in the central nervous system, resulting in impaired communication between nerve cells and the rest of the body. Now, ultimately, MS becomes a neurodegenerative disease in which the nerve cells are destroyed. MS can cause a variety of symptoms like vision problems, fatigue, numbness, tingling, weakness, pain, cognitive impairment, mood changes, and mobility issues. While the cause of MS is unknown, it is believed to be influenced by genetic and environmental factors, lifestyle factors, the immune system, which mistakenly attacks the myelin. Here can play an important role in the diagnosis and treatment of MS, as they can provide information about disease activity, progression, severity, and response to therapy. So biomarkers can help to diagnose MS earlier and more accurately by distinguishing it from other neurological conditions that may have similar symptoms. Biomarkers may allow us to monitor the disease course and the effectiveness of treatment by measuring the levels of inflammation, axon loss, and neurodegeneration in the central nervous system. Biomarkers may predict the prognosis and the risk of relapse, disability, or cognitive decline by identifying subtype stages and patterns of MS. Would allow us to personalize the treatment and optimize the outcomes in MS by selecting the most appropriate and effective therapy for each individual patient based on their unique biomarker profile. So, what are some examples of biomarkers in multiple sclerosis? Well, there are many potential biomarkers. Few of them are current use, but there are many that are promising, and we're just now seeing the emergence of these biomarkers in the everyday clinical practice. One biomarker that has been used for a very long time is in the cerebrospinal fluid, and that is the measurement of oligoclonal bands. So that is part of the 2017 revised McDonald criteria for the diagnosis of MS, where oligoclonal bands can be one of the findings that help to establish the diagnosis. And this has been done for a number of years. However, there are other biomarkers, such as neurofilament light chain, which reflect the immune activity and the neuronal damage in the central nervous system. There are blood biomarkers such as cytokines, chemokines, and microRNAs, which indicate the inflammatory and regulatory process in the immune system. There are imaging biomarkers such as magnetic resonance imaging that can visualize the lesions, atrophy or loss of volume, and functional changes in the brain and spinal cord. And then we can track those changes over time to predict response to treatment or to predict whether or not a person might be at risk for, say, secondary progressive multiple sclerosis. There are genetic biomarkers such as human antigen genes, which are associated with the susceptibility and variability of multiple sclerosis itself. Now, what are the challenges and limitations of biomarkers in multiple sclerosis? Well, despite the potential benefits of biomarkers in MS, there are also many challenges and limitations that hinder their development and implementation. Some of the main challenges and limitations are the complexity and heterogeneity of MS itself, which makes it difficult to find biomarkers that are specific, sensitive, reliable, and consistent across different patients, subtypes, stages, and regions of the brain and spinal cord. The lack of standardization and validation of biomarker assays, which leads to variability and inconsistency in the results and interpretation of biomarker data. Perhaps the ethical and practical issues of biomarker collection, storage, and analysis, which involves the consent, privacy, and safety of patients, as well as the cost, availability, and accessibility of biomarker resources and technologies. And then there is the gap between research and clinical practice that takes a long time to really translate what's happening in the lab or in the research centers ultimately into everyday community neurology practices.